So, as all of you know, climate and health requires a multidisciplinary approach where we need a whole of government approach. So we're really excited that multilateral funding is now sort of following this approach with this Nigeria World Bank grant. So this was a grant that was approved in September last year, which actually included 3 separate grants. One on sort of climate and education and health governance structures. There was a second grant, and these were equal size grants. And the second grant was on strengthening primary healthcare. And the third one was really on climate change and strengthening resilience through improving dams and irrigation systems. So we are so pleased that we have 2 panelists live with us from Abuja, Nigeria. We have Olumide Okunola with the World Bank, who sort of coordinates and leads this financing. And then we have Emmanuel Alhassan, who was formerly with the Nigerian government and now works with the Global Health Advocacy Incubator. And I think what we're trying to do is to really see how these components were put together in this particular innovative project financing. Also how all of these various sort of sectors work together, but also the technical and political dimensions of this grant. So I think there's a lot to learn because we're hoping that more and more multilateral financing can sort of be structured in this multidisciplinary way. So I'm going to now turn to our panelists. So good afternoon, and thank you so much for joining me at, I think it's nearly 6:45 p.m. in Abuja. So thank you so much. And I'm going to first turn my question to Emmanuel Alhassan. And Emmanuel, so you've been working closely with the government of Nigeria for a long time and on a lot of different issues like epidemic preparedness, immunization, strengthening healthcare. What do you think are the priorities, with this and other financing for the government of Nigeria?
Yeah, thank you very much, Vandana. So in terms of the climate-related health threats and, what is very concerning for the Nigerian government, there are issues, that around, climate change, increasing infectious diseases such as malaria, dengue, yellow fever, cholera, and typhoid due to warmer and wetter conditions. There is also the issue of respiratory illnesses like asthma, COPD, which will rise as a result of air pollution, while cardiovascular diseases and diabetes are projected to also increase. And then, of course, you have issues around mental health, because we know that climate stressors will elevate mental, will elevate mental health disorders, interpersonal violence, and stress-related conditions. There's also the issue of, extreme heat, which would increase the number of heat-related deaths, which is actually forecast to double by the year 2080, affecting urban populations disproportionately. And of course, we also have, coastal and agricultural vulnerabilities because of flooding, particularly in the southern parts. And then there's also going to be a lot of health care system strain, because facilities are going to be overwhelmed and services disrupted. So these are the issues that are very key, that the government is really keen on looking at and responding to adequately.
Thank you so much. So I turn to the question I think a lot of people want to learn, to Olumide. So how sort of unique is this financing package in the World Bank? And also, how did you bring all these various sort of teams together to create this multidisciplinary climate and health grant? Olumide?
Yes, thank you. Kindly confirm that you can hear me.
Yeah, very well.
Oh, great. Okay. So maybe one of the things I should do, well, first I work in the Health, Nutrition, Population Program of the World Bank. I'm a senior health specialist at the World Bank. As you know, the bank is very focused on the human capital development agenda. And what the World Bank has done is to develop a series of projects to help Nigeria accelerate its human capital aspirations. These projects are what we call Hope Governance, Hope Health, and Hope Education. These three operations collectively come up to about 1.5 billion US dollars because each operation as a standalone is about $500 million each. So that's 1.5. However, it adds more than that because some of those operations also have additional grant financing attached to them. So Vandana, they're not all grants. There's a 1.5 billion across these operations that's a credit to the government of Nigeria, meaning it's actually Nigeria spending its own money. So just to get that clarified. And however, because of the kind of aims and objectives in those operations, you have private and other partners putting in grants to even expand the available financing. But just to very quickly, before going into the climate aspect of your question, I start from the health systems perspective. We talk about resilient health systems. One example of a resilient health system is one that has human resources for health, is one that is able to have public health facilities that are opened round the clock. When you make financing available, or to make financing available to have or hire human resources for health, or have public health facilities that are open 24 hours, you need to have budgets that are appropriated in time, where financings are released. These are decisions that are not made in the health sector. They're made upstream. And that is the rationale for linking health, education to upstream actions like governance. So those three operations, going back to where we started, you have Hope Governance that addresses upstream actions, which are situated outside of the health sector, but then they both affect decisions made in health and education, and then coming to health and education itself. So that somewhat explains the multisectorality part of it, which is in itself a unique operation within the bank and for the country itself. But it is also unique because it integrates climate change adaptation measures throughout the length and breadth of the operation. If you can just I hope I'm able to share my screen. I just wanted to very quickly show you graphically why this is so important. Please, Vandana, kindly confirm that you can see my screen.
Yes, we can.
Fantastic. Emmanuel has articulated the relations between climate and health. This map of Nigeria pretty much just shows you in real terms what Emmanuel had so eloquently described. So on my right-hand side, you have the under 5 mortality rates in the country. On the left, you have the climate vulnerability risk index. They don't match 100%, but if you put them on top of each other, you will realize that where the vulnerability risks are highest is actually where you have the highest risk of under 5 mortality, even in areas that are green, which shows that, they're very low risk is not altogether true, because if you zoom down into some of those areas in terms of either rural or urban disparities, they're going to just be as red. But pretty much just to emphasize that this is for real, and we're seeing it in poor health outcomes. And indeed, that's why, in fact, going forward, it's not likely that there will be a health project that will not take on board climate risk in its designs. And so you could summarize and say that pretty much two objectives with this operation, because this is almost a greenfield area, so to speak. First, there are actions, just to, again, quickly, because not everyone might be conversant with the lingo of the bank. This operation is a program for results operation, meaning that states and the governments participating in the operation are incentivized to deliver on actions for which they are then incentivized. So here, if those actions do not happen, you do not earn that incentive. So unlike another instrument, which a lot of people might be familiar with, which we call the investment project financing, here upfront we would have articulated certain interventions that needs to be financed. Then we do the documentation, you implement, and that's it. Here, it's only after you have delivered that you earn. So it's a very sharp instrument. And it's also a good opportunity to integrate climate actions into health system strengthening more broadly. So we got two actions here. First is to advance a policy agenda for climate in health. So states and the national government are incentivized to develop the necessary policy documents to institutionalize the governance arrangements. You need health system specialists who will actually be looking out for the climate interventions that are distributed across the disbursement link indicators for the operation. And then on the service delivery side of things, so in this operation, we're expecting, for example, 774 comprehensive emergency medical centers to be live. But then we need to have climate resilient measures built into them as they're being upgraded. Same thing with basic emergency operation center that will be delivered under the operation. So this pretty much, I could go on and on, but those are the kind of key things that makes this operation particularly unique, not just for Nigeria, but across several parts of the world where we're beginning to see climate shocks show up in poor health outcomes. Back to you, Vandana.
Thank you, Olumide. So I want to say that a World Bank loan does not necessarily translate into immediate action, because you do need political will. And I think that's something that we really want to touch upon, that, and ask Emmanuel, as he works across advocacy and the space of creating political will, that how will this, large-scale sort of multilateral funding create political will for really taking on the tough challenges of climate and health? Emmanuel.
Thank you very much. I think that it is very important, to use this as a basis for increased domestic resources for climate, related interventions. And so, for instance, the Global Health Advocacy has worked across a number of verticals in Nigeria and across several other countries. And so, for instance, advocacy for increased funding for epidemic preparedness is something that we've worked on in Nigeria in the last 6 years that has really, really catalyzed political commitment, engaging lawmakers, engaging the executive, and also ensuring that the citizens really are part of this entire process, along with the media, to really advocate to government that in addition to donor resources, that government on its own really looks inward and really increase funding for epidemic preparedness in a sustainable manner. And I'm very happy to announce that that model has worked. And for the Nigeria Center for Disease Control, for instance, we witnessed an over 100% increase. In fact, twofold increase in budgets across 3 years in a sustainable manner. In the same vein, in Nigeria, we're also working with the relevant government agencies, particularly the National Primary Healthcare Development Agency, to ensure that not only are financing, obligations met, but that government actually also increases, domestic resources to ensure that we fully fund our immunization program in Nigeria. So in the same vein, it is very important for government to really pay attention and to really, put down more resources in a sustainable manner for, climate, related interventions in Nigeria. And I think that it's also important for other countries to collaborate and in such a manner that we can look at different financing models that prioritize climate resilient health infrastructure and also leverage international frameworks like the WHO operational framework to build climate resilient and low carbon health systems, and to also support initiatives that integrate climate adaptation into national health policies. In just summarizing my response to this question, it's very important for national governments to prioritize this and to ensure that there is more local resources allocated to health. And I think that all stakeholders, including civil society organizations, should actually join in the advocacy to ensure that this happens.
Thank you so much, Emmanuel. I'll kind of open up this question along the same lines to both of you, but perhaps starting with Olumide. So what role, Olumide, did sort of domestic financing and local institutions play in the development of this package? And also, what was sort of the element of political will and how much was that sort of demand-driven, from Nigeria? So we'd love to hear you unpack that, as many countries are interested to learn from this experience.
Thank you. I hope you can see my slides, right?
Yes.
Fantastic. So, maybe for those who are not aware, Nigeria is a large federation with 3 orders of governments. And South America, where you are, there are also quite a number of large federations like Nigeria. The problem with federations is there is a diffuse accountability framework. If states do not deliver on their constitutional responsibilities, who then holds them accountable? That kind of thing. So some countries have used these federal institutional arrangements pretty well, some not so well. Nigeria sits in that bucket where it has not been able to successfully hold its different, especially lower orders of government, accountable to what they should be doing. So, for instance, health is a constitutional responsibility of the lowest orders of government. So, and that is one of the key drivers of the poor health outcomes that we have. And one of the things that the federal government of Nigeria did was established a National Health Act of 2014. And within that framework of the National Health Act, it established what is called the Basic Health Care Provision Fund. So this is a grant financing from the federal government to subnational orders of government so that they can focus public financing, scarce public financing, on the priorities, including all of the poor health outcomes and climate resilient interventions. And in fact, Emmanuel was one of those who supported the advocacy to make this successful. But you see, this is the start point because we cannot talk about domestic resource mobilization in abstract. So here you have the federal government putting a financial framework on the table to say, look, I am putting my own money so that subnational orders of government can prioritize additional financing for health. In fact, beyond this reform, 2 years ago, the current administration, under the current president, supported by our minister, then brought all governors together to say, look, we are all going to align behind a common framework. And that common framework, all development partners and multilaterals will align behind it. So the first lesson is that once a government comes up with such a unified, common agenda, partners do not really have a choice but to coalesce behind that. Not just that, it also sends a strong signal that, look, this is a whole of government effort. All the orders of government are now involved, and in fact, we will get a higher return for our investment. So on one hand, you have, by law, the National Health Act, which puts federal government financing on the table, but then you also have the soft power of the sector-wide approach through a swap compact, and this is it. That same day where the president launched this sector-wide approach on UHC Day 2023, all governors, so that's the president seated, those are state governors behind him, signing a swap compact, say, look, beyond the monies that we are providing through the BHCPF by federal government, we as state government, we would also prioritize public financing for all of these actions that matter. So if this does not happen as a foundation, every other commitment is more or less meaningless. So this provided then a strong framework for multilateral partners like the World Bank, other development partners, bilaterals like FCDO, Canada, JICA, Children's Investment Foundation, Financing Foundation, to then coalesce and bring substantial resources behind this government's agenda. So I think the story that has emanated from Nigeria in the past 2 years has been one that has been led by government, driven by government. They've sent out a strong signal. And as partners, we really didn't have a choice but to align with it, especially when a government has prioritized that agenda. And that's why this operation has been able to mobilize significant domestic resources, but not just that, it has also been able to mobilize grant financing as well. Like I mentioned at the start, Vandana, so you had $500 million complementing government's own budgetary allocation, but then you had 10 million pounds from the FCDO, $12.5 million from Children's Investment Fund. You had $50 million from the Global Financing Facility because that agenda was compelling. And I think this is just the way to go. Back to you.
Thank you so much, Olumide. Now I want to just take a moment to see if there are any questions, because I think there's a lot of interest in unleashing such financing. So I think Olumide and Emmanuel have shared a lot of sort of unique factors and sort of the groundwork that was actually laid by the government with the health sector approach, the federalism and the buy-in of the states. But I don't know if there are any questions in the audience or online. Okay, I'm going to maybe turn back to you, Olumide. So to me, maybe the big question, which sort of is cross-cutting is, what are some of the unique, lessons learned for other countries? When you look at sort of the Nigeria example and look at this multisectoral financing, what can some other countries learn to position themselves, better for this kind of financing? If you take that example, yeah.
No, I just pretty much summarized lessons learned in terms of some of the things I've said before. First is provide an incentive framework. So the federal government of Nigeria did that with its own revenues, saying, look, this is my own portion of revenues, but I'm putting it down to incentivize. And that work in federations, even in other governments that are not federations. So you have that incentive framework. But also behind that incentive framework, number two, will be having a prioritized agenda, to say, look, let's coalesce behind a common set of priorities. Because if you do that, then partners who sometimes we don't necessarily behave well because we want to finance our pet projects and pet interventions, you really then would align with government. And that is important, especially where money is tight. The fourth thing, in my view, would then be the ability to have an accountable mechanism, where, look, every year, twice a year, we will come back to you to say, this is what we have bought with the money. These are the things we have achieved, in a transparent manner, so that it's seen as a collective. It's like a board of a corporation, So this is some of there are challenges, and there would always be. So, for instance, in a federation like Nigeria, not all the subnationals are at the same level of technical capacity. So money, necessary condition, but it is not sufficient. So there's a need to match all of this with also being able to nuance and deploy technical capacity as needed, especially to states that do not have as much capacity. And you can never ignore the political economy of all of this. There's always that tension. So this operation is focused on basic care, focused on the rural parts of the country, focused on poor and vulnerable beneficiaries. Don't assume that is a given. Not necessarily so, because there are people who believe that, well, so what about the urban areas? What about those who are not necessarily poor and vulnerable? So these are tensions that, and which was why Nigeria had to move then from complementing the National Health Act with the BHCPF with a more or less a soft power to say, look, let's also sign a swap compact where we will all uniformly agree behind a set of common goals. Back to you, Vandana.
Thank you so much, Olumide. So we're actually up our time's up now, but I just want to say that I think the example of Nigeria is really exciting to learn from, looking at sort of a multi-sectoral approach, both from the preparation and the groundwork done from Nigeria, but also the really comprehensive approach from the World Bank. A lot to learn, and I think especially the political will and engagement of sort of domestic financing. So thank you so much, Emmanuel and Olumide, and I will let you go back to having dinner. Thank you.